thing changed really in like the 19th century because, you know, we've got more innovative with our tools. We got more innovative with how we did it. And there was a particular guy in France where we have the French system, which looks at sizes of catheters and bits and pieces as well, called Charrier. And they were battery operated lights, not on the mains. Still, maybe not, but I'll cover that. But he developed the gauge system. However, when you look back at catheters, probes, dilators, sounding, we look at any of those things that involve urethras or cervix in any way, shape or form, people have been doing this for a very long time. There are people quoted back as far as like 3000 BC, when we really go back and we look at the history of all of this. I was going to say Hippocrates. Jesus Christ, I'm really good, aren't I, at the moment? Like, my ass is killing me. I really need to do this every so often. But loads of people were into it, and they used to talk about how they could get through urinary obstructions and all sorts of different things. One of the common misconceptions around sounding is that it is just for penis owners. Everyone's got a urethra. It can be sounded. Can it be more complex on a cunt owner? For sure. And shouldn't be, actually. So those that are going, oh my God, my cock, I can't bear the thought of it. Actually, my urethra can take a sounding too. You can buy sets of sounds from all sorts of places, and they come in all sorts of shapes and sizes. So they're quite interesting. But they've really changed in the last sort of like century, especially with the onset of metal. When Poppy and I were we went to one of DK Green's, DK Leather's classes, and Poppy's husband was there as well. And you were given these situations where you had to choose what you could use, how you're going to use it, where you're going to use it. And it was quite cool. We were given this scene that we were in some kind of truck, a metal truck or something, can't remember the name of it, a big metal container, wasn't it, I think, with this. And one of the things on it was chopsticks and a bottle of whiskey. So I said, chopsticks sounding, alcohol, pour it clean straight up your urethra. I mean, that's what I came up with. Poppy said I was a bit dark, and she's probably right, because in her head, she was thinking of wooden chopsticks, whereas I have nice metal chopsticks at home. So it's really interesting about what we can use and why. So we need to think about the sort of material we use and why we use it. So when we talk about medical sounds, my dad's texting me at the same time, it just came up. We're also talking about sons, different names, different things in different ways. So you can have a look. So there are different, my dad's, it's a wonder I can remember my name. Bless him, he's having a little bit of a hard time at the moment. So there are different sounds, and there are different designs that can be put into a male or a female. I'm just going to go with that for a minute. I understand that lots of people get offended by that. What does VBNM mean? I'm being really an idiotic person here with not understanding an acronym. Sorry, is that my age? I am 56. I am going to call on that one. So what is VBNM? So we can get different forms of sounds. So different forms and shapes of sounds. What are they? They are along the lines of, so you've got Bakes sounds, that's what they're called. These are medical sounds. You'll find different sounds when you go and buy your sounds in your Love Honey or your wherever, like if you come to Lamb, there are sounds as well. And you can buy them in packs. You can buy them in packs of all sorts of progressive levels, and you can buy them separately as well if you buy them medically as well. So Bakes are like a rosebud or a bullet, which is probably one of the most common shapes that people use. So it's got that little rosebud top that then comes down as well. And they have a more bulbous end. Please, can I say, when you're playing with sounds, I don't know if anyone's going to add to this, make sure there is something on the fucking end of it. There are people who go into A&E and into hospitals who have things inserted into their urethra and it just sucks it up and it disappears. You will need potentially surgery if that's where you go with that. Have something on the end. Look, nature probably does its course. If you are quite calm and just gently push, or you do a piss, it's likely to come out. But if it's gone in too far and it's gone under a pattern, depending on where it's gone, too high. There was a case of a guy who went in for surgery. He was in his 60s, and they found they couldn't define what the object was, and he couldn't remember what it was. It had been there for that many years, and he'd been pissing around it, pissing blood, and having all sorts of things. Virgins bang naughty men. Is that what it is? I don't think it is. Apparently. Oh my God, that's me cleaning the keyboard. Sorry. That's So funny. There's me thinking, well, I don't know what VBNM means at all. And why are you cleaning the keyboard? Is it this exciting already? Who the fuck knows? Right, so you then got dittle sounds, and dittle sounds have more of a round end or a flat end. You can choose different different endings, happy or sad. I'm kidding. So Hank sounds have a curve at the end. They've got a slightly different shape as well, and they have a metal rib on each end as well that you can have. And Pratt sounds are much longer. They are cervical, I'm sorry, they're urethral dilators. I'm going to talk about cervical dilators in a minute, but they can be like a foot long. They are like, ooh, and they have slightly bent ends as well. And Van Buren have very, very strong pronounced ends as well in different ways. So you then have cervical dilators, and some people also use cervical dilators as sounds, and cervical dilators are used for all sorts of reasons. A lot of people use fingers now to test dilation of a cervix in a pregnancy. People will play with cervixes, which you can also come under this sort of criteria headline as much as you want. I mean, the problem with playing with a cervix isn't necessarily a problem, is the pain afterwards. And urethra has got a different, but a cervical, when you start dilating cervixes, because you're doing it, it can cause the most incredible amount of period pain or aching, and that can last for days. Whereas a urethral sound shouldn't hurt per se. And what I mean by hurt is it should hurt in a good way. If you have a stinging or a pain or a stinging sensation or anything else as well, something is probably going wrong. So you're always exciting, Debs. Oh, thanks. Is sounding painful? Is it always? Is it meant to be? I've always assumed it was a masochism thing. No, I would argue cervical dilation is a hell of a lot more painful. Sounds aren't as painful as you think at all. And they actually can be quite warm, quite nice, quite a nice feeling. Karis, I had to have medical, I really need my glasses. Had to have medical cervical dilation last week. Not my thing, very not. Nope, that makes my whole fucking womb go, oh! It is incredibly more painful. So uterine sounds aren't quite the same as urethral sounds. So again, please be very careful. One of the things Poppy always says when she does her medical 101, or whether she's teaching any of this stuff, there is a real difference between entering a cavity that is supposed to be entered, like the vagina is supposed to be entered. Arse, you could argue it is or isn't, but it takes our bodies quite well, but it has a more delicate set of tissue in and more delicate membrane, so it can rip and tear in different ways. When we start talking to urethras, hello, I mean, not meant to be entered. So that's really different. So we have to be more careful about what we're going to put in, how we prepare, and what we do, because they're not meant to be entered. Like, you wouldn't stick a sound up your nose. I mean, everyone's been having a really bad time with just doing their COVID test, haven't they? If you stick it up far enough, you're like, fuck, you know, that's some sound advice. That's funny. Have you been trying to play that one all night? Have you thought of that earlier and thought, I'm shoving that in there later? I really like that. That's funny. So there are different forms of sounds and different things that you can buy and use. Right, so what do you need to do? Sounding is a lot of fun. Start small, work your way up. You can buy plugs or you can buy sounds. Plugs are something you're going to put in and it's like a plug. You can leave it there varying amounts of times. Sounds are to go in and to go out and to play with, and we can also do stretching. Yes, honestly, Roy, look, anyone here who's had a sound here, anyone here and thinks it's fun and it doesn't hurt and it can be quite a nice sensation. Anyone here had that? Anyone here who uses sounds in any way, shape or form to say, this is good and I like it? There you go. Got one already. Yep. And if other people, if they've had them done, what you've got to do with this is that people assume that there's going to be a lot of pain. It's one of those situations when you go, it's going to hurt. Tongue piercing is a classic example of that. Our adrenaline rushes up. We stick our tongue out, put some massive like clamp on it. It's pulled out. I mean, I can't bear it because I can't talk for at least 3 seconds. And then once they've measured it and sorted it out, when they pull, they go poof right the way through. You shouldn't feel a fucking thing. You should feel pressure. However, at that moment, the adrenaline rush is, oh, I should be in pain. Fuck, I'm not in pain. Whoa, I feel a bit faint. Can happen for a lot of people. And urethral sounds are the same. Poppy says it can be painful too, which I like. Quick stretch depends on technique, just like anal, really. Absolutely. So you can go in, you can stretch, you can go bang, and you can go straight in. There are all sorts of things you can do. I'm going to say slightly, right? So when my daughter was born, my youngest, she was born with something called perforate anus. For the next, she had major surgery. So she had a colostomy bag for the first 6 months of her life. And at 7 or 8 months, or was it a bit later than that? It was around 7 or 8 months, they did the reparative surgery, which took 9 hours in total, 5 hours for surgery, 4 hours for recovery. It was a very serious piece of surgery on a tiny baby. They curled her into a ball. They cut her from her spine down to her anus. Then they cut her from her anus down to her vaginal opening. And then they electric shocked her all the way up to find, I say all the way up, it's a couple of centimeters, but it's really delicate. Then they found her bowel, pulled it back and did the reparative surgery. The problem is the bowel wants to heal itself. So the colostomy bag was left in for the next 9 months to a year. And I had to put a cervical dilator up my daughter's bottom every day, 4 to 5 times a day for the next year. One of the things I spoke to Keith about it, the surgeon, quite a lot. He's a bit of a smart mouth, whatever. He was nice, but he said, you can do it yourself if you can read this book. And this book was in Latin. And I said, you're fucking taking the piss. Nobody studies Latin. I said, but I did at school. And he said, I'm only kidding. Here we go. Here it is in English. He was a nice guy, but I said, no, fuck it. I'll have the Latin book. And it is interesting because I did read an awful lot about it, which is very similar to this. Because what you've also got when you start sounding, potentially, is a pattern of a way somebody's urethra goes. They're not straight as you think. They're slightly queer, right? So, and they can be really, really straight, or they can be a little bit bent like lots of us are. So the idea is that you get to know someone's urethra. You get to know where the sticky points are, where you push through, and you should be using certain lubes in certain ways that aren't as damaging. Yesterday, somebody said to me, the only people who say they don't like sounding are those that haven't tried it. Look, I quite like it. I've got a full set of sounds upstairs. I don't like the pain. I feel a bit panicky when I'm too stretched because I think, oh, UTI or something else is really bad. It's going to happen to me. And that's my head getting in the way. It's not bad. Kaz says it is fun as long as you are relaxed and the person doing it knows what they are doing. And we all have to start somewhere. This is the really hard bit, which is always about starting small and making sure that you are as safe as possible, which is probably why some of you are here. So what do we want to do? As I say, there are all sorts of things. So basically, we're putting a toy or some kind, preferably metal. It could be certain forms of plastic. I have a whole writing on toys. It's called Sharing Toys and Bits and Bobs and Cleaning. It's a really fucking important piece of writing. Get me, right? Fuck, I'm so up my own arse. However, it is a really important piece of writing, and I bet Namoria is probably going to look for it now, because if his eyes have already gone to the right. Namoria is this amazing human being up in the top corner for me who knows where my writings are. And I just updated it a little bit. And the reason I updated it a little bit is because I've listened to what Poppy said as well, especially about cleaning, and I've tagged her in and added just a paragraph about this sort of stuff. However, she has a brilliant piece of information that comes in a nice paper version of all the things you can do about Medical Play 101. So I've just added a few bits to it because I was thinking about today. So you've got to make sure you're very clean. You've got to make sure, there you go, she'll post it. That's good. I'm really glad. Follow her and read that sort of stuff. She's very good at that. And Jerry says, don't you dare think of bringing sounds with you this weekend. I feel that that's a challenge. Sorry, you did say CNC was all right, didn't you, Jerry, with Domina? I heard that. No, sorry, I'm just muting you. What did you say? That's a joke for anyone listening. Of course, I don't mean that. But I would agree with Domina, you can't decide till you've tried it once, because actually for a lot of people, the fear is worse than the actual doing. So it used to be used medically to clear obstructions. I mean, probably not always the best idea to push it in, just saying. But that's what it's done. But it can be a very satisfying form of play, of sexuality and everything else as well. There are our genitals, our bits, our urethras. We are so full of nerves and nerve endings around all of this area, which is sexy fucking stuff. And that's the glands, the head, penis. We've got the clitoris, G-spot, and sounding can actually get to these nerve endings in clusters, in places really nicely. So it's really good fun. And it can be. There are no health benefits to sounding. Thank you very much, Namoria. So if you haven't read one of my writings, please read that one, because that is how to clean every single toy in your fucking collection. And boy, do we get cleaning and sterility and disinfection wrong. Badly wrong. So you've got to be really careful. So it can be helpful. It can be nice to us. You can argue, that a more satisfied sex life makes you feel more satisfied, therefore you're happier. So there could be a benefit. Roy says, thank you. And Domina says, see, Deb says, Gallant is sitting beside me right now, crossing his legs. And Simon says, this is why in every perverse house there ought to be an autoclave. Well, and this is something that I would say, if you have metal, and I put it in that writing, if you use metal toys, and you can buy one and you can afford one, buy an autoclave. Often the popular way of cleaning and disinfecting and sorting things out and making them sterile is actually boiling, top of a dishwasher or whatever, but boiling has its limitations as well. Using alcohol has its limitations as well, depending on what you're using. So please be careful about what you're using and how it makes a difference. So what does it feel like? Well, that's a good question, isn't it? Depends what you like. I think it's a warm sensation. I feel like, so like when I have to have a scan every so often, and I have a scan, but I have to have, so there's something that shows contrast between, like you can get a scan with contrast. And when you have a contrast put into a line, you get this incredibly warm sensation around your crotch that goes, go pee. I am peeing, maybe I am. You know, like you sit on a heated seat in a car. Has anyone sat on a heated seat? It can feel a little like that, but more internal. So some people feel like they want to pee. Some people feel like, oh God, I'm not sure about that. However, sterilize your fucking sounds. Sterilize your sounds before you use them and sterilize your sounds after you've used them. Don't wait till the next morning. You'll be surprised what bacteria and organisms can grow and stay around. It can be really boring, but if you're going to play hard, wash up hard, clean up hard. These are your hands. These are really fucking important. Wash your fucking hands if you're about to do something, and wear gloves. But not everybody likes gloves. If you've got a close and intimate relationship and you know that you've washed your hands really properly with all the right things, that's very different as well. So do that as well. And go slow, go gentle. It is a bit of my motto: play hard, clean up hard, the BDSM house elf motto. It is. It's, you know, like, if you've got sheets that are covered in shit, I mean, literally, metaphorically, whatever, you know, the likelihood of you, if you sit up in it and you rub that against your fucking urethra, hello, E. coli, I really fancy a UTI. Like, think about things, clean your own bits, fucking hell. I talk about this quite a lot. But if you're going to do sounding, wash well, wash carefully. Your natural bacteria is fine. Anything else? Yeah. Gloves, like fluffy mittens, absolutely. We're going to play a game of who can sound who with big fluffy mittens, and we're just going to shove and see what goes where on Jerry. Roy, I'm going to remember this every time I use my heated car seat now. I've ruined you for life, sorry. And for fuck's sake, don't be so proud. If something goes wrong, yes, take a little bit of time. You can see if it comes out. Don't panic is one of the keys. If a sound disappears into somebody, don't go, oh, fuck! That is the worst thing anyone can hear from the top end. Seriously. I mean, I asked Poppy about one of hers. She's disappeared for the minute, but honestly, oh no, is not a thing we all want to hear. Poppy has her own thing, she said many months ago, years ago, whenever. But, oh, fuck, oh, shit, is not the thing you want to hear as a sound disappears. Yeah, oops. Ah, oh, fuck, that's gone. Anything. Explain what's happened. Just had a look online. Amazon have autoclaves from £70. Look, if you're going to do this, you want to do it properly, time to start fishing now. I'm going in. Don't do that. Right, so yes, autoclaves are good. Make sure you get a good one, good reviews, and so autoclaves are a really fucking good idea. If you sound every so often, it won't cause any stretching issues. How about, don't worry, I've got another one. Oh, hang on, I think these are magnetic. If I stick a magnet onto the end, what will happen? They're not, but that could be quite good fun. Oh, fuck, I've lost the magnet as well. Maybe have a big magnet, but see, we're thinking the same stuff. Depends what it's made of. So please be careful. If you use, just as I typed, great minds, Mark, great minds. If you keep using sounds and you go for sound stretching and you stretch on a regular basis, you will impact the size and how your urethra works. You will stretch it out. Now, for some, that can be part of the fun. For some people love that, like ears. I just like my little holes in my earrings. I've got some earrings. Some people like a massive, great big hole and like plugs and different things to put in. It's the same with the end of your cock or the beginning of your urethra. The problem with a cunt and a urethra is your urethra is really close to your anus. With a penis, that's not the same. So your urethra is at the end and your anus is way further back. for lots of men. I'm just complimenting every man I know. Look at the length of my fingers. That's crazy. So that's kind of at length. Sorry, men. Sorry, cock owners. Right. So think about these sorts of things. Just go slow. I mean, it's my favorite thing in BDSM. I talk about it all the time, don't I? Do everything slowly. You can always go further. You can't always take it back. It will, as I said, if you start playing with really big, ribbed, like textured sort of toys, you will start to change your urethra, potentially long-term doing it a lot. If you're going too hard, too rough and whatever, you can rupture, you can split, you can cut, you can do all sorts of things as well. So again, please be careful. Think about that. There are risks. UTIs are very fucking serious. A UTI can make you lose a kidney. A UTI can kill you. Most UTIs come from E. coli. I think it's around 80%. I need to check my figures on that, but I think it's, have I linked that? Yeah, so it's around 80 to 86% or something of urethra infections, UTIs, are actually caused by E. coli. However, there is a different bacteria, one's positive, one's minus, and that's another percent, and they both need different forms of treatment. So if you are one of the 10% and you get treated for the 80, you can end up in hospital and be very, very, very ill. So look out for a temperature, look out for feeling a bit dodgy, look out for not feeling quite right, and go and check your urine, please. Go and check if you have any symptoms whatsoever. You can cause cuts, and that can cause issues, and of course you can cause tissue damage if you're going too hard and too rough all the time. And of course, if you don't use enough lube, look, different people like different lubes. They do, and different lubes work different well for different things. From, if you think about the sort of lube you use, depends on the sort of human that you are and what you like. There are different lubes for anal, there are different lubes for vaginal sex. Some work differently. Anal lube is a little bit thicker. You want something, I mean, Poppy might have she might have an expertise point here, an expert point that says, I would only use this lube. I think you have to do your own research. I think you have to look about what you like and how it happens. What's good for you. If you have any form of UTI or potential infection, do not use sounding. Go and get yourself checked out, get a course of antibiotics and make sure you're okay. People also use things like natural remedies, like drinking cranberry juice and different things to help their urine flow. That can help as well. If you have an active, if you have anything like gonorrhea or herpes or anything as well, don't sound at that time. That's really important as well. So please be careful. I have a client who has UTIs every month. She has had so many investigations. She's really in trouble. Again, don't sound if you have consistent UTIs. And I think there's something to do with prostate illnesses as well. So please be careful. You can get small sterile lube packets, best option I've had. Yes. So, is it Cergilube for sounds? I always use sterile lube and found a lot. I've only had I sound a lot and I've only had one UTI ever. So exactly my point. Find the right thing that works for you. It's really important. Sterile as possible. If you're going for the thicker lubes, they get caught in different ways. They'll collect at the end and they'll stay and join differently. Different lubes have different impacts for different parts of the body, for all our holes and stuff as well. So as I say, there are different things that you can use, and some people might use catheters as well in different ways. Don't forget that. Honestly, if you're going to go for some form of sound, that you're probably, I would personally recommend, up to you where you go, I would go for a surgical grade stainless steel, preferably. Easier to clean, easier to look after. Titanium can be really cool. They're easier to insert, they're lighter, they're not as heavy. Surgical can be a bit heavier. Some people use silicone, some people use plastic. Great as well. I mean, if you want to look after the planet, maybe think of using steel rather than silicone or plastic. If you're somebody who is very conscious of uses of plastic, so you can say your sounding is ethical and against global warming, that's always quite a nice feeling for anyone if you feel very strongly about that. And they can be easier to clean, so you can't use chopsticks then. You can use chopsticks, Simon, if they are metal. I have stainless steel chopsticks. I will lend a couple to your missus. And we can see. And actually, they start very small and round, my chopsticks, and they expand as they go up very, very slightly. So actually, they would make quite a good sound for science. They don't make a good sound because if you go, oh no, there's nothing at the end to pull them out, make anything okay. So please be careful about what you have. And then what we're talking about here is, what I was talking about there is the shape and the size. Some are used for stretching, some are used for length. Some are used for pleasure, some are ribbed or textured in some way, shape or form. Some have holes and holders and bits and pieces on the end, so of course they're not going to go in and disappear or be sucked into the body. The anus has the same problem. When we shove stuff up our arse, often we're like, oh, my fist is going in because I'm not sure where that's going, because it's quite a long cavity, so these things disappear, and your urethra, especially on a penis owner, can make a real difference as well. Please, as I said, sterilize everything before you start. A lot of people will use betadine. I've mentioned that, and there's a few others. Wash yourself, make sure you're clean, start going for it. Listen, I'm going to be really realistic here. If you are a very large woman, like me, I'm a size 18. It is really difficult to catheterize yourself or to sound yourself. You need to have a good access to have a look about where you're going, or understanding your own body and understand where it's going and how it goes. We've got to be realistic about these things. So get someone else to do it with you, for you, so you start to get the feel of it, so you can see where it's going to go as well. Please use soaps. Soap is a really good old-fashioned thing. Clean your hands. I've said that 3 or 4 times. You can stand up, you can sit down, you can whatever. You don't have to have a look in a mirror. You can do it by feel, but people are very, very frightened of that. If you don't want a sterile lube, your other option is a water-based lube, and your other option is a chemical-free lube. I wouldn't go for something that's full of shit, metaphorically, because it could cause more issues as it goes in. If you're not very flexible, also very hard to do, because you need to keep your legs open. If you are a cock owner, what a lot of people work for is a semi hard-on, because it's easier. All of these things help us get in there. So what questions and what else do you want to say about using urethral sounds? It's a very simple thing to do. It's a lot of fun. Some stretch, some all sorts of different sensations. And a plug, as I said, is fairly different. So a plug is a short toy often. It'll be anywhere between a couple of inches long. Oh, can you see Goose? Goose is there playing. So that's her, that little white blob there. That is Goose. Goose is my puppy, for those of you that don't know. She's very, very sweet. I really like her, and I have a really big white long-haired German Shepherd as well. So if you want to get used to it sounding, you can wear a plug. It can really, some people say, not all, some people will turn around and say that it increases their orgasm, or it makes them more intense. Some people will turn around and say that it makes them more sensitive, so they prefer that. And some people say it helps with erectile dysfunction. There is no scientific evidence.
You're talking about actually fucking with the thing in there.
No. I'm saying over time it can make a difference. No, don't fuck with it in, because it will get lost inside someone. If you fuck with a plug-in and that plug isn't set, the likelihood of it disappearing with your bacteria from your urethra into somebody's cunt or arse is large. Don't do that. And that's not good for bacteria. And then you're at the hospital going, so I did this thing, right? And that's when also your partner says, I'm not fucking taking you, go alone. Fucking hell. Right, so, that's, when your relationship's made, when somebody says that, I've got this thing inside me. It wasn't me, it was! But, you've got that sort of thing going on all the time. Oh, dear. So plugs can really help. Look, a plug for a cunt owner, way more difficult. Do you recommend only trying sounding with someone experienced, female genitalia? Look, the likelihood of you meeting someone who's experienced with sounds is small. If somebody advertises and says, yes, I've got a lot of experience, someone might be able to help you, for sure. I think if you're doing it with someone who's inexperienced, listen to the last half hour again on YouTube, go slow, listen to all the things about being sterile, the sort of sound that you want, the sort of material that you want, the sort of size that you want. So start small and start, the sort of lube you want as well. So have a listen back it's on YouTube under Lamb, so you can listen back to the last half hour. I love being able to catch up on this on YouTube. Oh, thank you. That's really nice. So, and Cinda said another reason to go slow with sounding is no rupture to the bladder or uterus. Yes. All this shit is really, really close. Do you remember I said earlier about tissue and about, we are such delicate beings internally. You'd be surprised. You would. And if you For example, if you start wearing a coil, the likelihood of that coil, and it can happen to a girl who used to live with me here, you know, I advocate the coil. I think it's a great thing. And she was like, oh, I think I'm going to try it. It was great for me. I never advocate it for everybody, personal experience. And hers ruptured her bowel and it was horrendous. She was so ill and she was in hospital for 4 days. Everything. So this is the next thing I would say. Go and look up the anatomy of everybody's urethras. Go and look it up. Look at what it's close to, look at how it works, and look at what you need to do around that. Because when you understand how close everything is and the thinness of membranes and tissues and all sorts of bits and pieces that we've got in there, anything too hard and too fast can go sideways, upwards, down, other side, and then you're in trouble. What type of sounds are good to start with? Most sites online seem to be J-shaped or slightly S-shaped. Or they have a rosebud tip. What are they each for? Scene Cancer says, I would use a pre-sterilized package singular sound and sterile lube and avoid sensory deprivation and bondage and play. Go slow and communicate if new, but we all start somewhere. So what Poppy's saying there is when you have a single soundboard that is absolutely cleaned and sterile, what we're talking about is a sort of sound. Most people on average will use a more rosebud tip. That's the more common tip that people use. But we can get wavy ones and all sorts of different textures. If you use something that is sterile for you already, don't ruin the sterilized aspect of it. If you take it out of the pack and you touch it with your hands and you go, well, that's quite interesting, it's quite bendy, isn't it? Or it's like, look, it's completely solid because it's metal. You're like, or whatever, you've just ruined how sterile it is. So again, have a setup. You can have a box that's just meant for stuff like that. You can stuff stuff in. If you're brand new, won't the rosebud tip be too much? Wouldn't thinner be better? Yes, of course, depends on what you want, depends on the sensation. Some of those rosebud tips are very tiny, but they help glide in and they create the vacuum that helps pull it in. That's why it was invented in that way. So it creates a... I don't know how to medically say that. Anybody else know what that is? So the thing about a rosebud tip, you know, I'm so sensible and medical, aren't I? It's really important because it helps guide itself in and through because it pulls with a slight vacuum, leaving it at the end. And honestly, the smallest urethra with a rosebud tip is tiny, really, really tiny. So it's a good noise. Thanks. Like negative pressure to suck it up. Yes. A wine cork. I was about to do that and I realized how long my nails were and I thought, I won't do that. So be careful, go slow, use something sterile, have something that's all set up for you. Please read that piece on sharing toys and cleaning because it's really important. And Poppy sounds like she's going to publicize this, which is all about, I got it from her workshop the other day when she was doing Medical 101 and it's really fantastic. So she'll probably put this out. So it's all about medical play as well. And that would be really relevant for this. Look, can sounding be dangerous? Yes. Dangerous side effects, permanent damage. There is research into this. Sounding, so there is a correlation between higher STIs and higher UTIs and sounding. I want to know why though. So right, when we just do a piece of research and those two, they have a natural correlation. Actually, is it because that person is more likely to be sexually active and want to do things more and therefore does more with people, therefore is more exposed to things, which I think is probably more likely. Vibrating is funny. Think that's the risks people who engage in sounding, what she said here. 90% of what we do can be dangerous. Well, everything we do can be dangerous, can't it? Fucking hell, walking through the street. But with sounding, what I'm interested in, it is how you do it. Please think about slow, small, careful, cleaned, sorted. Again, go for overkill. Put 6 pairs of gloves on. I'm kidding. Never put more than 1 pair of gloves on. Actually, that isn't particularly good. And it actually adds issues. But urethra is supposed to pour out. That's what it's there for in many ways, shapes or forms. So, and if you cause a kink in it or you start to cause issues, yes, you can potentially have all sorts of issues because you can leak, you can block, you can have tearing. So please be careful about what you do as well. So, and a lot of people won't go to hospital with this sort of issue. Seriously, they won't because of shame. They just won't. They're like, oh, fuck, awful. But, you know, as I said, there was a really interesting piece of research on this quite a long time ago, which showed an unidentified calcified foreign body in a man's bladder of 17 centimeters long and 12 centimeters in diameter. It was just, I mean, he'd had antibiotics and he'd done all sorts of stuff. So, hey, be careful. I had more than one pair of gloves, can be good for needle play in case of sticks. It acts like a squeegee and cleans the needle. Actually, if you want to check your research, Domina, seriously, on gloves are more likely to make you have a needle stick than if you have just your hands, because we're complacent with them and they don't help us have a good grip and they're not sure. So please listen to people who are not knowledgeable, more likely to tear, more likely to cause issues, and Poppy would really know about this stuff. Yes, the agenda, Ash, is that we're talking about sounding, then we're going to go on to, people ask me questions in advance quite often, or can ask me questions on the night, although we've already got 3 for today. So we started with sounding because somebody asked about it, wanted to learn about it, and we're also talking about emotional masochism and sadism, and we're talking about interrogation play. I'm learning at a kink shrink webinar. So no, never more than 2 pairs of gloves. And if you're a really confident, fucking good person who knows how to clean their hands, I can't believe I'm saying this in public, sometimes no gloves is better. Oh God, that's so unpopular, isn't it? I'm sorry, but that's true. Especially if you haven't got crazy nails and you know how to scrub and you've used the right sort of things. Like, Jesus, if you really want to go for it, use something like Hibby scrub on your hands. I mean, please check your allergies clearly and all of those sort of bits and pieces. But Hibby scrub is that pink liquid that you get before you have surgery, and they ask you to wash in it for a day or so before, if you've ever had surgery, and you can buy Hibby scrub over the counter. So if you really wash your hands and you wash them properly and you do everything which you've all learnt during COVID, I'm sure, and you're all doing after every time you go to the toilet, because E. coli causes the most amount of fucking UTIs. So hey, you all do that, don't you? All the time. Of course we don't. But honestly, Hibby scrub or something like that as well can actually be better than a glove. Poppy, please back me up on that a little bit. But it is true. I mean, it is true. Medically, it's also true. You ask many a doctor, the most sticks, especially, they come from people wearing gloves. And then people do stupid things like, yes, it could dry your skin out, but on your hands, every so often, it won't cause issues. It's dexterity versus wiping. It's an age-old debate. It is. So again, be careful. So please be careful. We understand it's erotic. We understand it's lovely. I do it. I've done it. However, things do disappear and you've got to be very careful and just be aware. So urethral sounding can be fun. The amount of foreign bodies that are left in a body is fucking rare. You're talking about 0.00 something percent. It's nothing. If I'm having unprotected sex with this human, I'm not wearing gloves personally. I kind of agree with that. If all of our fluids are in, then I'm in. Like if I'm fisting you or I'm doing something or you're doing that to me, Jesus Christ, kissing contains more bacteria than licking someone's fucking ass half the time, apart from a few major ones, clearly. So, clean your teeth, clean your skin, clean your cock, clean your cunt, clean your ass. Be careful. Please be careful. Think about these things. Okay, so any questions or statements anybody wants to make before we go on to emotional masochism and sadism? Because that's what we're going to talk about, and then we're going to talk about that interrogation play. Domina, I believe you. I've never played with anyone that I'm not fluid bonded with, yet some cross-contamination know-how is all theoretical. Yeah. Re-sticks, cinders. I've had regular blood tests for the past 30 years and never had someone take my bloods whilst wearing gloves. I had my bloods taken today and the nurse wasn't wearing a glove. A few medical staff have said that the gloves hinder them and can't grip the needles as well. My nurse today, as I say, she took the blood first. Black wasn't the best. And I've got fucking good veins. So it's, yeah. So should we, shouldn't we? As Poppy says, it's a really age-old debate. Honestly, if you are fluid bonded with somebody and you are clean, and by clean, I don't mean that you had a shower this morning. I'm not talking about clean, not talking about hygiene. I'm talking about sterilization and cleanliness. So you're ready for these sorts of things. Then gloves aren't always the best option because of quite a few reasons that I've already mentioned. Oh, this is going to go out publicly and people are going to go, who the fuck does she think she is? Right, so let's talk about emotional masochism and sadism. Anyone here an emotional masochist or an emotional sadist? Me. It's my favorite thing, emotional masochism. Like, fuck, it's the thing that turns me on. I'm a cut queen. I love being tormented over somebody being so much better than me in some way, shape, or form. Right, can I just talk as well about, so let's, before we go into this, I'm genuinely not sure. Yes, a lot of people aren't. I would consider this edge play. I really would, because you can fuck someone up, utterly fuck someone up, especially if you talk to all their shit that they feel or think about themselves. Often people aren't cruel enough, and sometimes people just are too cruel. So people, and Steele said, getting into it carefully. Mutt said, I really love this to extremes and weirdly sleep so much better after a scene with this. And Mim says, no, I don't like it when it's deliberately done. Yeah, okay. And that's, so it's a really hard limit for some people, which is right. But, you know, on a mild level, we also do it. It varies. If it's a no for you, please have it as a no. Don't experiment with it. We know that when we look at sticks and stones can break my bones, words can never hurt me. What we know in the last 100 years is that ain't true. When somebody is bullied or told things all the time, they start to believe that it's true. So if you practice emotional masochism, I want you also to practice emotional positivity, and from the same person, preferably, even like hours afterwards or whatever, where someone says, by the way, you do realize that was role play. None of those things were meant. And I came from a point of wanting to turn you on and having a fantastic time with you and to connect with you. So just be aware that if you do damage, you also need to create positivity a lot of the time. So think about that as well, because then their words will stick in. Eleanor Roosevelt once said, no one can make you feel inferior without your consent. And I really believe in that. I talk about life's coffee table as a therapist. If I say, oi, fatty, some people in this room, thin and fat, will turn around and say, who the fuck is she talking to? She's rude. And some fat and thin people will say, fucking hell, she means me, doesn't she? It's got nothing to do with the size that you are. It's got everything to do with how you feel about yourself. So someone put it on the coffee table, you picked it up and you read it. And that's the danger. If you hear a fizzing sound, Goose is just chewing on some electrical wires that are plugged in. Figure she, you know, she's got my consent. I think I'll just move her. Goose, come out. Yay, Goose is alive. She's not dead. You fucking idiot. No, don't lick me. That stuff licks your ass. It's not ideal, is it? So sticks and stones can break my bones, but words can really hurt me. Absolutely. Then don't mind being called slut, etc., but deliberate withholding of contact. Oh no, that's a hard fucking limit for me. Deliberate holding contact when done by an alleged sadist to me is playing with his, particularly when contact is stressed as important by me. Nah. I'm going to turn around and say to you that withholding, okay, sadism has to be, emotional sadism has to be consented to. If you don't consent to that, that's a hard limit. Within the umbrella, ooh, don't lick me. Within the umbrella, hard limit. Red, Goose, red, red. She's listening. A well-trained dog. Right, so what's really important is we also have to make sure that we agree to these different aspects. There are very many aspects of emotional sadism and masochism, and they're very different. You might love to be called the word slut. You might hate to be called the word whore or cunt. You might love small penis cruelty. OCD can get triggered quite suddenly. Not sure about phobias. Anything can be. So if you have it's not just OCD, it's not just, anything could be triggered here. If you feel bad about yourself, self-harm can be triggered, eating disorders can be triggered, OCD can be triggered, self-esteem can be triggered, you name it, all of it. Suicide potentially. This is edge play. So you need to agree what is and isn't okay around this whole spectrum of emotional masochism and sadism. There is a masochistic personality disorder, as in creating a new condition. Yes, all of those things can be triggered. Like if you continuously call someone fat, they can end up with body dysmorphia, they can end up with body dysphoria, they can end up with an eating disorder of any kind, and that could be new, or even calling them incredibly thin. There is an old disorder that used to be in the old DSM, but there are arguments as to its clinical applicability, again, nowadays as well. Masochist is something that's sort of a sexual behavior. However, there are people, when you look back in the 1980s, where people had a masochistic personality disorder. And I still think that's around to a certain extent. So you can have a look at all sorts of craft ebbing and all sorts of different people who talk about this and work their way through it. And they carried it. And the definition at that time, can I ask the topic? I apologize for coming in late. Oh, right now we've just spoken about sounding. We're now talking about emotional sadism and masochism. So that's what we're talking about for now. So it used to be if somebody suffered from, what was the definition? Like it's consistent, pervasive, self-deprecating, self-defeating type behavior. That used to be the definition in the 1980s for it as well. And it presented itself in very different ways. So people choose situations where they're disappointed. People choose situations where they are mistreated. They choose to be a victim all of their lives, might be subconsciously, and they choose to be rejected often, and they reject help and everything else as well. So I think you've got to be careful, and they can make people angry. Now, you can say that's many a personality disorder nowadays. You might say that's borderline. You might say that's many other things as well. But it's how we destroy ourselves, really. And I think it still is quite an interesting potential for people to also be using that sexually as well, or emotionally, or for some kind of sexual turn on. So I'm just saying that there's a masochistic personality disorder that used to be there as well. Unintended emotional sadism in a relationship drove me to attempting suicide. Thank you for sharing that. I really appreciate that. That's really brave of you to share, Nemoria. It is utterly destructive. So related to Hannah's question, would you advise anyone with a history of emotional trauma and neglect to avoid emotional sadism? I have two answers to that. Watch my followers go down by a couple of 120 people leave the room. Fucking don't do it. Don't do it until you're ready, right? However, what some people will tell you is that by doing BDSM and by practicing BDSM, you open yourself up to it, that you get used to it, and it can make you better. There is a percentage of people that does happen for. So I see that. For me personally, as a therapist, and as a therapist who's also trained in trauma, I'm really sorry, but I'm going to go with, unless you have dealt with that trauma in your head, the potential for that to be triggered, I hate that fucking word, but the potential for that to be triggered is consistently there, even through exposure. Because when we do something like this, so like one of my best examples of this was a man, male, cisborn male, wanted to be kidnapped. And he was kidnapped. I've spoken about him before. And he was kidnapped, and he had a great time, and he was loving it until they said something about his children. They said something about his parenting, right? Which wasn't off limits. Nobody had said anything. Nobody had said, don't say that or whatever. He didn't think it was going to come up. Why would it? And it absolutely broke him. And it broke him for quite a long time. So you might, listen, there are great ideas like for interrogation. There are great ideas around sadism and masochism, but fuck me, you've got to know your boundaries and your limits. And the problem is, if somebody just creates a slight hair or a crack and just does something tiny that gets to you, all that stuff that you're suffering from, that you're not okay with, and you have trauma and neglect in your past, then that could all just be ruptured open. Part of what we talk about in trauma is exposure, but it's exposure with somebody who's trained. It's exposure with somebody who knows what to do if you go to a place that's really bad for you, who can help and support to do those things. A lot of my clients say, it's amazing, Deb, we just chat and I seem to get better. And my argument is, yeah, I paid 200 grand to learn how to chat. It's amazing, that, isn't it? And I can't tell you how much more I've spent on all the things that I've done, like specialisms, trauma, like just to study. And yet someone comes along who's some kind of dominant and says, I'll do that. Oh, okay. So I would be careful, is my answer to that. Have a plan. People are being really nice to Moria, which I love. Domina said, sorry to hear that, very serious, glad you're still here. I'll never find all of Deb's writings otherwise. True. Don't do it again, Nemoria. But I mean, that works. That's therapy. That's what people pay me for. Stop it. Stuff works. Nemoria said, thank you. And Domina said, you're welcome, but it's purely selfish. And Mark said, I think particularly unwise with a neglected sub where they aren't in a mindset to fight against the oppressive idea. The problem with neglect, right, is different to emotional masochism. Neglect is the lowest form, which is then the highest form of abuse that we can put a child through. When a child suffers from physical abuse, their brain develops pretty normally. If you look at an MRI scan of a child who has had physical abuse, their brain structure is fairly normal. Their responses won't be. They have trauma and different things have happened to them, and it's fucking awful. I'm not comparing. I'm saying with neglect, the brain doesn't even develop normally. If there is enough neglect there, the child loses the capacity and needs to be taught. And as they're taught and as they are nurtured for maybe the first time in years, then their brain can potentially grow and change slightly, but it will never be completely normal. There are really interesting brain scans around this with MRIs where there's almost like a butterfly pattern in a child who has been neglected. So with neglect, it is incredibly serious. It's very different to abuse. I'm really sorry to separate them. I'm not saying one's better or worse than the other. Please hear what I'm saying. I really want people to know that that's not a differentiation I'm making as far as who's got it worse. I'm saying the impact on the brain is different. So if you suffer from neglect or have suffered from neglect and it's been pretty shitty as a form of upbringing, then sometimes that person's capacity to heal is different to somebody who has had different forms of abuse. So I will go with be very careful. So I personally think that emotional masochism and sadism are very personal. Emotional sadism needs to be like a roller coaster with a safe ending that has an uplift that places the masochist above the starting point. Whilst I agree with that, Mr. P, the problem is you can't guarantee it because you don't know what damage has been done on the dips potentially unless you really know that person. I think if you're, let's use the roller coaster as a metaphor. I think you need to start with the kid is trains that just go ding, 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 and I'm back to the beginning. And then slowly you get one of the little ones that goes, as a little bit of a bump, which terrifies a 3-year-old, not a 30-year-old. And then eventually you need to build up. And you don't know what's going to trigger someone. You can say, oh, but I do. And then we're told by other people. And eventually when we get to know people, why do you think people enjoy emotional masochism, Deb? So I'm going to come on to that in a minute. So what we get is a positive sexual response from it. That's how it's classed as. So when I have some form of psychological, emotional, mental, present suffering that's in my mind and in my brain, then if I like that, I'm probably an emotional masochist. A sadist is the person who likes inflicting that. They're the exact opposite. They enjoy the words in different pieces. But sadism, that's interesting, isn't it? Is it really sadism if it's what I want? Can I also point out as well, please be very careful, because a lot of the time, sadism, especially emotional sadism, can be very mixed up with dominants who are abusive and like to control. And that is a very dangerous point that we all need to make and think about. So there are a lot of people who are very cruel. I'm really sorry. Who was the person? Somebody said before about being ignored. I need to go back up to find your name.
Probably.
So if you are being ignored, personally, I find that abusive. That's what I find. I find that abusive if it isn't okay. I think it's soul-destroying, deliberate withholding of contact. I think, yeah, it was human. Myriad of angry abuse and silent treatment for weeks, months, then back again as if nothing has happened. Yes, I get probably should walk away, but it does trigger a huge level of down is the up, the contact reestablished. I think it's about cruelty. It was human. So like, I would also, like, some people will turn and say you're dating a narcissist. Not necessarily true, right? Because people go, oh my God, they're love bombing you. Then they pull away and now they're love bombing you again. So you're going to go back. Maybe this person is breadcrumbing you. Maybe this person is manipulating you. They don't necessarily have an NPD, a narcissistic personality, or an antisocial personality disorder. They could just be an utter cunt. And there are plenty of those around. I would turn and say to you, if that's the journey you're on, get off. However, that doesn't work, does it? Because you're saying, no, I want to stay. I guess what I would ask you, Mim, if I were your therapist, is what alternatives can you see? If you don't want to get off the ride and you want to stay on it, what other options are there? How can you control this ride differently? You come up, your brain, come up with those. And of course, if we get some kind of emotional masochism and pleasure from the awfulness that we feel, because I think a lot of emotional masochists do consent to some awful stuff sometimes because they're not aware that they can say, no, I'm not doing that. And then somebody said ghosting or blocking you when they have acted wrong, the lack of closure in an argument via these methods is another form of abuse. Yeah, I would agree with that. However, I'm also going to argue that actually never getting closure in an argument is also okay, because closure is getting what we want. It's a very Americanized term. Sorry, Americans. We want closure because we want it all to be okay. We're not going to get that, especially if we're dating a cunt in some way, shape, or form. It's really hard for an emotional masochist to say what's going on inside them, really, to say this is what's happening to me and this is what I like. So when Domina asked that question, it's quite difficult. It's also difficult to consent to it and to actually do it, because the top will think, fuck, I'm killing this person. What do I say? What, you know, I remember telling somebody I like severe, complex emotional sadism. And you know, he went, oh, you're a naughty girl, aren't you? And I was like, no, that's not quite what I mean. You know, and so that's, you know, that's the difficulty here. And then he said, well, okay, so I've got this woman I really fancy. Here's her picture. And I went, oh, hang on. Number one, have you got consent to show me her picture? That's where I go. It's just rumor sex drive. I don't know if you know if I've got consent to see her, but let's say he has. And then he says, look at her while I'm fucking you. I want her more than you. She's beautiful, isn't she? I can't wait to taste her or feel her. Now we're getting into my head. That's much better. But it's all about what works for you personally. If you cannot describe what it is, so you've got to be really careful about what you do and what you consent to, because if somebody was taping what was going on, they would say, oh, that's severe and extreme abuse. So please also make sure you can consent, make sure you know what you're asking for. This needs serious conversations. And as I say, it's a hot, boom, that's abuse button for many of us. It's awful to see. So what do we mean? We don't all respond to the same stuff. There isn't a one-size form of masochism that fits all of us in any way, shape, or form. It's just really different. And we have to think about that. So it might be that you like it sexually. So, you know, it could just be pain, couldn't it? So it's just, we like that, and that's the way that it is. There are lots of forms. It could just be abuse or control. People can call it abuse. But I think emotional masochism is the one that's the most difficult to consent to, the most difficult to negotiate over, and the most difficult to even be aware of. So as part of your negotiation, one of the things you've got to agree is if a hot button is pushed, if a red button is pushed, if something is triggered in you, that you don't hold the other person responsible, that you are aware that consent is there, and that you need a catch-all afterwards to say, right, we're never going to do that again. I realize I hadn't covered that. Like that person saying, shit, you mentioned my kids. Boom, button, not okay. Or you mentioned my weight, or you mentioned my age, or you mentioned my whatever it is that you've got that is very personal to you. Mim, I don't get pleasure from it all, but I do when the person is being nice. It's the sugar and spice thing. It's been over years too, my own fault. Perhaps therapy would be the way, as you can rationalise why you stay when they are being shitty. Mim, I don't have any spaces. Seeing counsellor does. Go and get some therapy. Go and get some help over this. Sometimes we need to pull a boundary to be able to say, this is abuse, this isn't the fun. The thing about the going back, one of the reasons I love cut queening is because they choose me at the end of it. So it's, but you can argue that pain masochism is the same. So when you have a masochist who has pain, it's the care afterwards that some of us like. So we suffer the pain for the care. Emotional emotional masochism can be the same. Mark says pre-mortem all the way. Oh, did I miss a comment, Al? Sorry, where is it? What does it say? Let me go back up. I do miss comments every so often. I find it hard working out the difference between things. I've got into degradation play, but not humiliation. I don't know if I do emotional masochism. I would say, I'm going to come on to that ironically in a minute, a little bit about humiliation, degradation. And again, I've got a huge writing on this, humiliation, all you need to know. That's a massive one. So I'll come back to that one, Al, I promise. Sorry. Is degradation also emotional sadomasochism? The answer is it can be. Depends how someone defines it. Because what you've got to find out here is what's your line. When you're playing with someone, what's the line you don't want me to cross? Is that degrading? Well, it depends if you consent to it as well. So there are differences in humiliation, degradation, and emotional sadomasochism. I would argue that degradation and humiliation are part of emotional sadomasochism for most people most of the time, not all. So it could be about power. When you have a total power exchange, it could be that that's an emotional masochism where I can't do that and I'm not allowed to, but you'll do when you're mating. I'd still think that there is an incredible high level of risk when you've got, if somebody is continuously emotionally pushed and told that they're not good enough, or they're not okay, or that they're a piece of shit, or they're not worthy of anything, or they're not okay. Emotions can't be seen. Bruises can, damage can, but not enough damage. Like sometimes we can't always see physical damage. Thank you, Nemoria. So let's have a look. A few comments have come up. Mutt says, sometimes I struggle with the aftercare being so extremely contrary to what was said in the scene, where I may feel better if I'm left to sit in the headspace afterwards and come out a bit slower. Again, I've written, so boring, I've written a writing, fucking hell, I probably have if it exists. I've written a writing on negotiation, and I've written writings on consent and aftercare and drop. I've written writings on all of those things. Shit, goose, scared the fucking shit out of me. Right, so the thing is, for me, what you've got to do as part of this is negotiate your own aftercare, because your aftercare could be, don't ever want to see you again. Don't fucking call me. Your aftercare could be, leave me alone. And your aftercare could be, sit with me and stroke my hair and tell me you love me forever. Like, it depends, doesn't it? We're all different as to how much aftercare we want and what it looks like. It could be make me food. It could be fuck all. How do we do that? Because it's a Sunday night. We're both going to work the next morning. So it's a real variety, isn't it? Okay, Mark says, Mistress Callie's book, Enough to Make You Blush, opened my eyes to how specific masochists can be to what works and is boring and what is unacceptable. This is my point about negotiations. This is the problem. You need to talk to the person you're about to play with, and you need to negotiate. This is why I wrote Negotiating Shenanigans. You have to, like, people say, oh, I just want to let it happen. Great. How do you reform trust if something goes wrong? That is so much more damaging than if you don't. You're much better off going slow, especially when you're meeting somebody. So it can be really problematic. However, if it is a negotiated journey and it's negotiated, then it's great. You break trust a little bit to create trust, especially with severe emotional masochism and sadism. When I do degradation as a sub, I'm very aware that it's a temporary play. I enjoy the scenario, but know it will end soon. When I'm feeling emotional masochism, I almost wish it would never end. I feel the same way about it. I feel utterly lost in it. And the only thing I can say is it makes my cunt hum. That's how I feel about it. I can feel every bit of me tingle and go, oh, yes, this is what I want. If you don't have a pretty cunt tingling or cock tingling response, then it probably isn't for you. So it's very different. How do we talk about this sort of emotional masochism? Well, actually, one of the things we have to look at in this, and we have to think about all the time, is it creates a cognitive dissonance. What does that mean? That means it causes a conflict on, thank you, Nemoria, you are so wonderful. That's the writing on negotiating. So it's a cognitive dissonance that's created. What do I mean by that? So it creates a conflict between thoughts and emotions, maybe around one subject, maybe around one focus, but it creates a split in us. So I don't want my dominant to find me unattractive. However, if he calls me a fat, ugly cunt, that turns me on. I don't want it to be true, and that's the cognitive dissonance in that moment. Does that make sense? And it might also be that I really want that, and that would be lovely, but I kind of know it isn't. And that's where things like compliments can go really wrong. You're so fucking beautiful. I love your body. Oh my God, how can you? I'm a fat old woman, right? So like we do it to ourselves, don't we, as well? So you have to watch that. But good emotional play is about playing with that dissonance, that split in us that says, oh my God, but see, in order of, it's got to work a little bit. You've got to make sure that it does work for you. So there's got to be a little bit of truth in it. And that's when it becomes dangerous. And I'm also going to cover this when we talk about interrogation. You want some truth to it, but if it's too truthful, it can really be damaging and hurt. So it might be that we are playing with our fears. Fear is really important in play. If you don't play with fear to a certain extent, your play is always going to be very safe emotionally, right? So, and that's okay. That can be really lovely. But if you want a lot of fun, I think Unicorn Husbandry wrote a piece today on safety and fear. Him and his partner really play on the edge of fear to really fuck them both up a little bit because they find that exciting. Because actually, boring is the antithesis. Like, it's really bad for it can be really bad for relationships, complacency and different things. Lizzie says, it's weird. I enjoy being the female bull in a cuckold situation because I know he chooses her at the end and I'm just used as a toy almost to torment the cuck queen. Can I get your number? That's a joke. It's a joke. Not sure why I enjoy it so much. Is it a type of self-emotional masochism? No, it might not be. It might be that you enjoy being used as a toy. It might be that you enjoy the power in the moment. It might be that you enjoy the fact that that person isn't committed to you because you don't want to make a commitment and you have a really good time and know that they're going back. It could be for any number of reasons. And Shania says, I love my man to shut his eyes while he's fucking me and tell me he's imagining I'm somebody else. So do I. He thinks it's such an odd turn on of mine. That's cuck queening in action in that moment. However, there has to be an element of truth to it. There has to be a fear of fuck, he might leave me for somebody else, or fuck, she might leave me, or they might leave me for somebody else. That's what, so that emotional sadism is that tiny flavor of it might, but then they come back and it doesn't. So it really makes a difference. So it's often quite a deep-rooted fear that people have got, and it's something that we have had anguish over in some way, shape, or form, potentially. Bodies, shapes, all sorts of different things. Now, the argument can also be that exposure can make us feel better about it. Again, very dangerous. That's when it is dangerous. And also part of it is that sometimes the way our neural pathways work is if we have experienced something that is quite shocking or not okay to us in some way, shape, or form, we may have sexualized it over the years. And when we sexualize it, it becomes a warped way of dealing with it. Now, that warp can be good and that warp can be bad. It depends. So we have fetishized that process, potentially. So you could argue that it's partially a fetish as well in some way, shape, or form. So we've made a sexual association with it, and that puts us in that place that says, yes, I feel fucking amazing and wonderful. So it is a form of fetishization, if you want. Debs, did you ever feel cuck queening was something you needed to deal with, or have you always been happy with it? It's something I have dealt with. So I have brought it to therapy. I've discussed it. I've looked at the damage it creates. I've looked at the goodness it creates. And for me, often the benefits outweigh the damage. Do I want to do it all the time? Absolutely not. Not every week and not every month. No. But every so often, yes, my head goes, oh, I'm really craving that. Now, actually, it doesn't mean that my partner that I'm with ever has to actually do it. Actually, it could just mean that my partner just talks about it. So you don't actually have to do it. It could just be the talking, the comparison, because it's another way of feeling love for me. And that's that twistedness. So if you have an emotional anguish over this and you've come to terms with it, like you know it, I'm okay with this, this has happened, I'm good with this, I like this, it can actually work that we fetishized it into something sexual. High five for the twistedness. Thank you. Have that. So we've found a way of dealing with it. So it can really good. So as I say, it's the cognitive dissonance between what is so, what we hope isn't so. And it plays with that feeling that we have about ourselves in some way, shape, or form. So it's a truth we hope it isn't so. It's a truth we can say, yep, we accept it. It's the way it is. So like, for example, a lot of people play around orgasm denial. Do you deserve to come, you worthless little whatever? Look, for a lot of people, that will really work. And they'll hold it and they'll build and they'll build and they'll build and they'll build and they build. And if anyone's raising a hand, just type it down the side, please, because then I'll read it out. So it'll build and it could be really good. If you do that to me, I will end up just not coming. That's it. And they'll say, you can come now. And I'll go, no, that's not happening. So we all build up differently. So you have to find out. So that could be that, oh, that's nice and I accept it and I deserve it and it's lovely. But actually for me, it won't work. So it doesn't work. That's not my emotional masochism. It is somebody's. It could be, though, those truths that we hope aren't true are the ones that are really the severe, harder list when it comes to any form of emotional masochism. So you are inferior in some way. You are too fat, too thin, too loose, too small, too tight. You don't taste right. You don't feel right. You don't look right. You aren't the right person. So it really needs to get very nasty, and it's the worthlessness that's the extreme form of that emotional masochism and sadism. That's why a lot of people don't want to go into it. I really get that. And it could just be that you're only good for what you're giving me right now. Look, how many people say when they're getting a blowjob, like how many cock owners men say, I didn't realize this type of play had this name before you described it. Cool, we're learning something together. So like, you know, like when someone's got your head and they're skull fucking you, for example, or eating you out or biting or whatever, it really varies, doesn't matter, genders. You know, the amount of times you fucking deserve my cock, you worthless piece of shit. It's the only reason I've got you here so you can suck it, and then pushes you off up against the wall or something. That, you know, that worthlessness can really be a form of emotional masochism for people. But that could be on the milder level because we're used to that one, aren't we? Luke, loving that. Sorry, Luke. Is it slightly better if your head hits the wall quite hard? You're like, oh, and they go, don't care, as you go out, and they go straight down your throat again. I love it when they do that. Exactly, it's its own form of it's that own form of masochism, and that's quite sadistic from somebody if you think about it. But actually, that's a more accepted form. When you choke someone out, can we still then say you don't fucking deserve to live, you worthless cunt? Now that gets a bit more scary. Do you mean that? Are we okay? Oh my God, I know you were like, it was okay when you were just, your cock was like, and again, for some people, that might be really nice. Fuck, that's making my cunt fizz and hum, my cock, whatever bits I've got going, ha ha. And for other people, it'd be like, you're not okay. Listen, I've told the story before. You all know this. You don't all know because there are some new people here. But you remember me saying, you know, when this person was about to come inside me, how they turned around and said, I want to kill a toddler. It will really get me off. You know, that's not me. I'm out, right? So no. So somebody's just said, I'm bipolar and always been a monogamist. However, I'm now in a relationship with a poly partner, and I have realized this turns me on knowing and seeing him with other women. Is this emotional masochism? It could be a form of, it depends what you get from it. So the point here is if you like it and it turns you on, that's good emotional masochism. If it turns you on but you don't like it, there's potential for that to be damaging. So that's something to think about and reflect over. So are you seeing a therapist? Can you get some help over that? Nice kitty, this conversation has me extremely turned on. I'm sort of glad and not, but for God's sake, just don't show me, because we have very strong rules about that sort of thing in this room. So I also, at times, also my bipolar is a new diagnosis. I'm not sure what triggers are in my mood. Yes, so we do have to think about that sort of thing. So is this good for me right now? And is this how it works? And I would also argue that polyamory isn't about cuck queening, because what you also need is the other person's consent to share the sexual side of what they're doing with another person. So in polyamory, what you've got, or in open relationships, you need consent. If I'm going to talk about that person in comparison to you, I need that person's consent as well, if that makes sense. So again, it's based in consent for me. If your bipolar diagnosis is quite new to you, I would get as stable as I can. I would find the drugs that work for me. I would find a therapist that works for me, and I would get as stable as I can when you start playing with this. However, you have said it really turns me on knowing and seeing him with other women. If that works for you and that emotional masochism works for you, that's great. As long as you feel reclaimed at the end and you feel loved and cared for as well in your way as well, that's really important. Compassion, maybe. Yes, some compassion can be really good. And apparently everyone's saying Dominus covering her ears. Okay, we've got a lot of new messages. Noted Kitty, Joe, yes, she was. There it is. Right, so nice Kitty. No, I've never thought that emotional sadism could be my thing. I would never be disrespectful. So that's interesting, isn't it? See, I think personally, when it comes to masochism and sadism around emotional stuff, this isn't about respect. I want disrespect. If you want to respect my wishes, disrespect me. But the point there is the agreement, is the consent. So I want disrespect. That is a way of showing that you respect my wants and desires and wishes. So I think we just have to see it slightly differently, because respect is drummed into us, right? Respect is, you must respect, you must appreciate, you must do those things. You want to fucking respect me, call me a worthless cunt. Not you here now, but you know what I mean. So, you know, so actually I like to twist things, like Jerry said, nice twist. I like to twist things a lot for our benefit. So that's a twist that I would make for me. Yeah, it is about respect, but if you want to respect me, that's the way to do it for me. That's one of the ways I like, please. Dominic says, as soon as Deb started, I knew she was going to refer to creepy baby murder man. Not hot. No, it's not, is it? I used to think about degradation, took some getting used to. And it does. And it's quite difficult when someone says something, you know, and says it out loud. And you can giggle sometimes. Giggling is a really normal response. The key is not to collude. When someone starts giggling, if you go, listen, young lady, or young man, you've ruined the moment. You need to be able to turn around and say, stop. This isn't a game. Appreciate you think it's funny. You worthless little shit. Don't do it again. You need to be in the moment. You need to be somewhere else, which is very different to, I know, right? This is cool. Right. It depends what headspace you want to get into. It really makes a difference. And eye contact and the tone of voice and everything else really gets to us as well. So we're looking at some quite deep stuff here. It's about how our headspace is. Luke says, embarrassed in the moment. I love being told I'm there just to do that and feeling worthless, and that verbal is a turn on. Though if that word was used in a certain way, it would totally get to me. I agree. I agree, Luke. And I'm laughing at Domino. I never wanted to receive degradation until me. I feel like I did a good piece of acting there. Thank you very much. I'm kidding. I really can do. Jerry's in. I mean, you're staying there. Right. So I think you have to look at what those truths and that cognitive dissonance is a really sort of important thing. And of course, we've then got the glorious mind fuck, haven't we? And that can be related to what we're going to go on to in a minute. Fuck, I'm going to go over again. I'm so sorry. If you want to go, but I'm clearly going to talk for the next 20 minutes, aren't I? Because I haven't even covered the next topic. So mind fucking is a really good thing to do for some people. However, to mind fuck somebody totally, you need to know their mind, and you absolutely need cognitive distance to be there. They need to be in their right space. Debs, what the fuck was that? That was truth. That was non-collusion. That's what that was. That's our capacity to say, I have to use that as a therapist. Sometimes I choose to collude. So like, for example, I've had a client, I still see her. She came back after a while, who used to joke about how, I used to try and kill myself with a scarf in the cupboard, but the cupboard kept collapsing, that pole. We laughed a bit for quite a while. And then after a while, when I really knew her, what I had to say was a different truth. Actually, that's not funny. And that's calling out something. And we need to do that. As a dominant, that's an incredibly powerful thing to do. And the switch is also incredibly powerful, to laugh and laugh and laugh. When someone says, oh, I can't do this, I can't do this, I can't do this. And then even in the same session, and you say, and that's not good enough. Stop. I mean, you're joking, aren't you? Like, fucking hell. No, I'm not. I am displeased. I mean, I can walk out right now. I can leave. Or you can make me change my mind. Step up. We can change things. It makes a real difference in a moment. It does. A private message I've just had 7 years ago. I had someone mind fuck me merely to suppress me. 7 years and I still have trust issues from a 37-day affair. Are you kind of saying maybe a little self-inflicted emotional sadism could ease this? No, I'm not. I'm genuinely not. I'm saying, if you have something that has happened to you, please go and find somebody who's really good about trauma and about everything else, and see that person. And then if you feel you want to play with that, you can play with it afterwards. Don't play with stuff that can fuck you up. That's what I'm saying. Domina, impressive. Slaves here, like, you should practice that. Yes, I should. Yeah. Hi, slave. Yeah, it's quite an interesting thing. So look, with a mindfuck, we need to feel helplessness. So it has to be very agreed and very sorted. I'm going to do this. This is going to happen. We're going to play this. We're going to do this differently. And someone goes, no, I can't. I don't want to. And this is where CNC can come in as well. So when we have, consensual non-consent, like, you don't have the right to say no to me. We all have the right to say no at the end of the day. We know what we're saying. So it's quite difficult. So emotional masochism is not abuse. Okay, you might like emotional masochism because of some damage or rejection or something else as well. Please get that sorted. But some of us also learn to live with those and we feel okay about it. that person said, it's nearly impossible for my therapist to even begin to understand. Quite the opposite. She made me feel like it was my fault for being involved in BDSM. I'm going to say 3 words to you really clearly right now, nice kitty. I don't know where you live or where you come from, but my 3 words are get another
therapist.
Absolutely not okay. What your therapist doesn't realize that they are doing is they are colluding. They are jumping on the drama triangle and persecuting you because you think that's what you deserve and that's what you've had for most of your life. A decent therapist will understand the pull to do that and will say, actually, Kitty, that's not your real name, but actually, Kitty, I'm realizing I want to jump on and tell you it's your fault. Let's work out why I feel that way with you. Let's look at what is happening here. Let's look at what is going on between us for me to feel that way. We need to understand the projection, the feeling, and everything else as well, right? That's what a decent therapist will do. To understand that that's come into the room and that's really working relationally. So you need somebody who is trauma trained and is also into BDSM, preferably. I think kink-friendly therapist can be a very dangerous word. You're right, Karis, but I think it can also be dangerous. I prefer to go with kink active. I do, because I want somebody who lives my life in my own way. Just a good therapist, even therapists with 0 experience of kink should do better than that. Yeah, so for me, sorry, Kitty, if you've got a very good... actually, the first step I would do, this is what I would do first, I would go back to your therapist and say, when you said that, I felt like this, not you made me feel, because no one can make you feel. We only feel because of our investment. I would turn around and say, interesting, I feel judged and blamed by you. I'm wondering if you've taken that to supervision, and I'm wondering if we need to talk about it in this room, if you feel brave enough. If you can't, again, wrong therapist for you. You know, I want my clients to call me out on my shit when I'm doing it with them, in case I am. It's really important. So the first option you could do is go to your therapist and say, there seemed, or there felt like there was blame in the room about me being involved in BDSM. Do you have a problem with this? Do you want to pathologize kink and BDSM? What's going on for you that I then feel that way? I would call them out on it if you can. If not, I would change your therapist. I really would. For any emotional masochist, at the end of the day, the thing you are most frightened of and the thing that we talk about the most or the least is utter rejection. When we're playing with emotional masochism, we're playing to the levels of rejection that we are maybe okay with, or abandonment, or anything else as well. This makes me feel quite emotional because this is all mild stuff coming up as well. So I'm really aware of it. So what we're trying to do with that deep level of emotional masochism is to play with that so we do feel a bit better with it. But my God, you need to have someone you trust to do it with. Like, change your therapist, you might change your dom. This is difficult shit to do, and it's complex. So you've got to be very careful about what you're doing and how. So the truth at the end of the day is a fear of abandonment, a fear of being left, a fear of rejection, a fear of not being good enough. And then that's where we play. Active absence. Yeah, so we play with it, but we like the person to still be there. And if the person is temporary or doesn't come back or doesn't feed us positivity afterwards, that could be really, really dangerous. I think you've got to be very careful. When you've got something really deep going on about not feeling good enough, let's take my sister. My sister isn't a masochist as well, but I'm going to go really, really, really well. Oh, that person just wrote, I fired her last year and come into your Zooms and others. So grateful to you always. Thank you, nice kitty. That's beautiful. I love that. So what I want people to do is go and get help in different ways. That's what I want. I want you to go and meet people who can help you and make a difference. Thank you. So what my sister doesn't have a right breast, right? She doesn't have a right breast. She had a mastectomy. If she was a pure emotional masochist who needed to deal with that, and her husband was a dominant, potentially in emotional masochism, he could say, you're fucking useless. You've only got one breast. I don't find you attractive for that. It's hideous. It's horrible. So this is how deep this shit can go. It might turn her on. It might get her off, but she needs to know that she's loved and okay afterwards. Because when we live through that abuse and the person has an emotional release in what they're saying and doing, they feel better for it. And sometimes that's just what someone needs. So it turns us on. It makes us feel desirable. It makes us feel sexy. It makes us feel good. However, it also helps to heal for some of the time. Please don't do this unless you've had a lot of work on this and you've done it in any way, shape or form. So, and I think it's very difficult. I don't like this, but it really turns me on. This isn't okay by me, but fuck, it gets to me. So it's how to do it. So the how to do it is the conversation. Maybe I should write a piece on this, like, so people really get to understand it, like emotional masochism and sadism. Maybe one day. Okay, look, I'm at time. I'm really sorry. If anybody wants to go, please go. It's absolutely fine by me. I really apologize, but I'm still going to cover interrogation because that's what people wanted as well. Goose, you're such a dangerous, like, have that in an interrogation and scare the shit out of you, wouldn't it? Rough. Whereas I can hear my other dog out there. Fuck, that's interesting, different. Right, so let's talk a little bit about negotiation, right? Please have a read of my piece again. Fuck me, get me self-promoting, setting a scene. When you want to set a scene, this is what's really important around interrogation. So what do I mean, interrogations and an interrogation scene? I know, she's so terrifying, isn't she? Goose! That's my other big dog. I can hear her. She's a hell of a lot bigger. Right, so a lot of people write about interrogation, and sometimes I really don't like what they write, and I will go into why very quickly. So if you want to go, please go. If you want to hear about interrogation, please say. Joe says, thanks for this workshop. I'm currently looking for therapy. However, I was actually looking to contact you privately for therapy or recommendation would be helpful. Worship was great. Joe, look, you've got the scene counsellor there. The scene counsellor is completely qualified and knows everything you know about trauma and kink and everything else as well. I'm pretty busy at the moment. I don't have a lot of space. Scene counsellor on FET, I would utterly recommend that you go to her. She's medically trained. She's psychologically trained. She knows a lot about this shit. She really does. And is a lovely person, and that helps as well. I mean, slightly. She's also a bit like me in that she's quite challenging because that's the way change happens and growth. So blushing, says the scene counsellor. But I honestly, Joe, that I would go there from dead to, oh, thank you, setting a scene. So try Poppy is what I would say, honestly, because I think you have to be trauma trained as well. Promoting your writing, some process better by reading, review is all good. Yeah, no, I get I'm up my own arse. I am to a certain extent. I'm happy with that. So let's talk about interrogation. Interrogation means different things for people. So if you want to stay, stay. If you want to go, I don't mind how many people are left in the room. Please don't feel that you have to stay. So let's talk about interrogation. So when you talk about interrogation, what you're talking about is saying that it's where someone is a victim and someone is an interrogator, and they might be a torturer or they might be asking questions. So you want to do an interrogation scene in some way, shape or form. Well, what do we mean by that? Well, you could, again, setting the scene really matters. Most interrogations, when you think about them, take place in cold rooms, in dark rooms, and often uniforms are included as well. You'll often find that the person being interrogated is dirty, isn't clean. So they're all things that you can now start to think about. If you want a decent interrogation scene, bring in a couple of buckets of mud, put them in your bathroom, throw your submissive in it, make them filthy. Strip them, make them cold. Again, fucking hell, can I please say all of this consent, right? We are not talking about this not being consensual. I mean, if you really want to go for it, add a couple of worms and bugs in the mud, even better. I mean, that's not for everybody. It's probably a hard limit for some. Or it might be that you don't let them eat all day. That will change their psychological well-being and their physiological well-being, and that can be a really hot interrogation scene. So exactly, but it is pretty so it could be that you are a police officer, it could be that you are an officer in the army, it could be that you are a spy who wants to know some information. Choose the bit that turns you on. If you're a police officer, I mean, worms are fine as long as they leave my damn urethra alone. Yeah, going back to the beginning. I don't know. Oh God, there's some fallacies, aren't there, about all sorts of things swimming up urethras. It's quite hard to swim up a urethra. Can I share that? It's pretty difficult. Have you ever tried it? Right here. It is quite difficult. So you can have costumes and a setup. It could be that, you know, you've got all sorts of different things going on. For God's sake, go and look up on YouTube binaural scenes and recordings. They are fucking wicked, but I'm going to come back to those in a minute. So set your scene. Set your scene means start with the submissive that you're playing with, right? You need to set the scene for them, which means they're set all day. I don't like interrogation scenes where you want to get a load of shit out of somebody and make them feel like shit, because that to me is emotional sadism and makes someone feel like a piece of shit. One sneaky way around that I really like is you get a second friend or somebody you don't know. So let's say for the moment, I would say to Poppy, I'm the dominant in this scenario. I want you to make up a secret and I want you to tell Jerry. I don't want to know what the secret is, but I need to get the secret from them. And I'm going to come to you at the end and see what's said. If you really want to go for it, that's a really clever setup, rather than you really telling me it's a secret to your, like, fucking hell. Actually go for a real secret. So Poppy, please, can you make up a secret? Please, can you tell Jerry, we're doing an interrogation scene and I've got to get that secret out of you. That's cool. That's sexy because there's a real secret to be had. And then when I start breaking his fingers and ripping his fingernails out, I might get the secret.
Oh, I was going to say I'd go for it until that.
But so if you set up a real secret, that's a clever secret to an interrogation scene. Or ask, try and get, so if you haven't got a friend, you could ask someone like me. It's just, I'll make something up for you. I don't care. So like if you haven't got friends who are on the scene, say, Deb, tell this person a secret. And I go, okay. Then we've got it set up. It doesn't matter if you haven't got a mate, and because what you want is a third party who won't tell you. The whole point is you have to know it. And then that's what's so exciting, is the top as well in that. You're never quite sure if you've got the right secret or not. And you don't know till the end. That's quite cool. It's quite sexy. So costumes and bits and pieces. Props. Props are really important. If you haven't let the person eat all day or drink all day, of course, please think about consent and please think about their well-being. To put really nice fresh cold water on there, or a drink that they really like, or to put their favorite food on the table is a really good temptation, isn't it? Oh, if you want to go into the more extreme forms of this, like I just said about broken fingers and all sorts of stuff, like, hey, like, I really like my nails. You can take these off without damaging my nails, but it will be quite uncomfortable. If you do that, one of these is going up your arse, but it could be part of a good scene, right? It could popping my lips. Is this what my husband bought and had delivered this Lanchester for my Christmas stocking? I talked to someone for that info. Exactly. A friend who had an excellent interrogation scene, the secret was their phone pin so they could be photographed. Nice, as long as you change your phone pin afterwards. Oh, thank you. I'd really like my nails. They're slightly orange and sparkling. Poppy, you could talk to someone, but he'd like it. Yeah, that's the problem, isn't it? So that can be a really good idea. So all sorts of things, a safe, anything. So like if you've got a lockbox with something in it and you've got the pin, that's a really easy one to get. Buy yourself a lockbox that's got a code. Have a padlock that's got a code. Let the sub put the code in, or the victim, not necessarily sub, the victim to put the code in, a padlock or anything else as well. So there are so many ideas that can work. Please don't go for something really, really deep and horrendous, because if you do, you are now putting emotional sadism in there, and that maybe isn't what the person consented to. So make them feel really uncomfortable in some way, shape or form. With someone I'm intimate with, I would torture them with close physical proximity while they are handcuffed. Yeah, exactly. So props. Could be handcuffs, could be silk, could be ties, could be tied to a chair, could be a cold, hard piece of wood that they have to kneel on, could be pencils on a piece of wood, could be wood that is really painful to kneel on. Dominant, I haven't thought this before. This is such good fun now. My cogs are spinning. I know, exactly. And your slave is sitting there going, and gallants go, oh, fuck off, right? Or thinking, yes! I love the real secret. Yeah, the real secret is an interesting one, isn't it? Because it's very hard to get into. But then you don't have the immediacy of knowing. But I quite like that for the top. It's a bit flavoursome of, oh, did I get it or didn't I? And then you find something, you go, right, fuck, now you're really going to fucking be punished because now I know it didn't work. And that's a really good setup for another scene. So, props. I mean, for fuck's sake, buy yourself decent props. Have a good time because you can use them again, but don't be medieval witchfinder scene is fun. Yep. Lovely. No drowning, no waterboarding, please. That's a very extreme form of play. I mean, you could do a little bit of drowning, but be very careful. Oh, please know what you're doing before you use water in any way, shape or form. Even forcing a shit ton of water down someone's throat, because actually people can die. That shit is really serious. No fires and stakes. Well, actually, why not? Why can't you put candles under someone's feet? As long as you know what you're doing, as long as you know that when that burns, the person might not feel the sensation. Can't be too close. Can be on boobs as well. Wax, all sorts of stuff can be used. Knife play can be used. We can also make sure that, for example, we blindfold and we put something in someone's ears. Playing music that somebody hates, really fucking hates, very loud. I hate death metal. Don't play it to me. I'm really bored. Play it. Obviously not too loud, it's going to burst my eardrums or cause any form of permanent damage. Binaural So like you can also find things where you can get a very conflicting scene. For example, part of the game in the torture, which is really good fun, is if, like, for example, you put something over their ears and they can only just hear you through it, and you're playing some really intense music or something else, and you say, I'm asking you 2 questions at once. What's the truth? And tell me what the tape's saying. And do you know, that focus just doesn't happen. It's really impossible. So they're already failing. Oh my God, Lola, that sounds so much fun. Which is, if make it elaborate and good cop, bad cop, teaming up with someone. I can see myself being the good cop with empathy and all the works. Yes, if you can get somebody, and if you can get someone, it's really good fun. Come here, I'll make it so much better. Just you and I afterwards, just say it. It's lovely, isn't it? I will, honestly, I know you've always wanted to do this. This is one of your favorite things to do. You'll have it, and you'll have it in 2 seconds. Just tell me, it'll stop. Play with those things, play with those words. You know, like if you love that certain form of blowjob, or you love that sort of form of like that treat, and you can actually have it there. I know your favorite is this. It's here. Slide it across the table. Take it. Just take a step. Domina's loving this, Cara says. Like the lieutenant in the castle. So props are really important. Could be favourite food, could be McDonald's, could be a forbidden thing. So like, for example, if you're controlling someone's weight, I'm not saying you are, and they're not allowed to eat certain things, and then they've got their favourite slice of cake which just comes across the table and just smell. And they've got, and all their, like, you could have all their senses cut off in any way, shape or form, that you can do different things. Of course, you can also start to hurt people. You can make sure that the person's senses are cut off. You can, you'd be the best interrogator ever. I have done it before. I mean, clearly I've done it before. I used to switch many, many years ago, and a lot. I don't talk about something unless I've done it. Honestly, I don't talk about it unless I've done it, because to me, that is disingenuous. I don't know what it is, but I don't talk about this shit unless I've done it. So yeah, I've definitely done this. So you can use all sorts of stuff. You can, I mean, Jesus, you can be a right cunt. If you want to be really clever, a very thin needle in a nail bed is incredibly painful if you want to really hurt somebody. Needles, you really want to hurt someone, soft part of the finger, painful, really fucking painful, and toes as well. Very thin, sterilized needles, toes and webs. Wouldn't you agree, Poppy? That's incredibly painful part. You are in my head. I know. And actually, if you really want to fuck someone up, they'll talk immediately as if you put a thin nail into the nail bed from the top. Thin, don't be stupid. Don't go for infections. Be really clever. And of course, you can just have bright lights in their eyes. Open your eyes, open your eyes, open your eyes. And open your mouth. You can make them drool everywhere to have something, you know, and you can even put maybe like a little smear of something really nice on their tongue and then take it off, and you can do all sorts of stuff. What does that say? What is that, Domina? Is that a mouth gag or a something? I can't see properly. Drool. It's a stapler. Yes, again, okay, I'm going to say something. So stapling can be really fun. I love being stapled. I don't find stapling particularly painful, but please only use one staple on one person in any way, shape or form. You can staple all sorts of things. I mean, Jesus, you can sew eyes closed if you really fucking want to. Don't do that unless you know what you're doing. Seriously. So you can also go with lots of silly little ideas, which are all about food flavors that people don't like, things that make people gag. You know, food that doesn't taste particularly nice. Think I'm a celebrity, get me out of here. So you can go down that avenue. You can go down pain avenues. You can go down discomfort, sitting on stuff, standing on stuff. You can have tape, you can have desks, you can have chairs, you can have all sorts of things. I just need to threaten to eat Lord's advent calendar in front of her, and she will tell me anything I want to know. Actually, you can also set up for failure. Oh, no, I wanted to say that to the person earlier who said they had lights put in their urethra, Christmas lights, battery operated. The different shape of those and the fact that those little bulbs can come off, really dangerous. That's what I was going to say. I forgot. Blackmail can be really, really good. Yeah, like you could staple them on somebody. That'd be very cool. You can also just hit hairbrushes, paddles, whips, chains, everything, cold chains, especially if someone's cold. There's nothing wrong with someone shivering and getting cold, as long as you can warm them up and look after them. Cold is pretty unbearable. If you really want to torture someone, honestly, a really good torture scene, let them go to bed, let them get to sleep. 11:30, midnight, 1 o'clock in the morning, just as they're asleep, wake them up with a start. Again, fucking consented to. This will be really weird if you go into someone's house and do this. You'll be arrested and you'll be in prison for a really long time, right? This is with somebody you're already with, or this is something you've agreed. Wake them up at 1 o'clock in the morning. Make sure you've had a nap. Do it then. Oh my God. Honestly, if they are slightly sleep deprived, that is a fantastic form of torture. It really is. You've got stuff in the kitchen you can use, from spatulas and wooden spoons and all sorts. Like, all of these things can really hurt. You know, we can really find something that the person, so yes, that's okay if they don't come apart. I would also argue they're just very hard to clean. I would want them, how to sterilize them would be quite difficult, because if they're that sort of plastic, they'd be really difficult to boil or to treat properly to get in all the nooks and crannies. Kaneko likes the sound of all of this. Well, you found and you think, well, a whisk can be used actually. So like a whisk on a nipple and twist can be really impactful and effective. I just wouldn't put it inside someone, especially if they've got a coil. As we all know, that is my scenario. So for me, I don't like all the fakeness of uniforms and stuff. I want to feel threatened. So you know, I would say this only once, does not work for me at all. I want to feel like I'm in trouble. I want to feel like you mean this threat in some way, shape or form. Please, when you read stuff, oh God, when you have a look at some of this stuff and say, I really want to get real information, I want your most humiliating moment you've ever had in your life. I want your deepest secret. Please don't do that shit. Unless you have full agreement, that stuff is really personal. That's the stuff they take 6 months to tell a therapist. They might not talk to you about it. You know, Jesus, like, as I say, a lockbox, a padlock, a real secret. You know, it depends what your person's turned on by. It could be food that they get at the end. It could be something like fun trick. It could be money. A lot of people like money. A lot of people like a present or something. I can guarantee you, like if Poppy and I were playing in this scenario, not that we play and we don't, because people ask that a lot, all I would need to do was say it's a Mulberry handbag in pink. She'd be there. Like, you know, I'm there, I've got it. And I'd be the same with, can I have an orange matching thing? Like, find the thing that turns the person on, whatever you want. Exactly. It's funny, isn't it? We just need to know what makes the other person tick, and that's about finding out. So that's why interrogation takes time. But it's all about the setup. It's all about setting the scene, which is why Nemoria posted that bit often. You can kidnap somebody. Please be very aware that if you kidnap, you're in public. I like the idea, or prefer it, of waking someone else up. You're going to say at some point this week, at some point, you are going to have an interrogation scene. I'm not going to tell you when it is. Do you consent? Yes. Good. Shut up. Don't mention it. So if today is Thursday, you might leave it till Sunday night. You might do it on Saturday morning. You might wake them up at 3 in the morning or whatever. It's much better to wake them up. Be very careful about kidnapping, because that is very serious. If someone sees you or reports you or something happens, it's quite difficult to explain why there is somebody tied and gagged in the back of your van. So also have a piece of written information somewhere, or a couple of texts where say, I'm going to kidnap you. Do you consent to that? Yes, I do. Can't wait. Thank you. I love you. This is great. I consent to all of this. At least have it somewhere so you've got proof in any way, shape or form. You could pretend to be someone, that it might be someone that they've got from their past. I know, for example, if I'm never going to do this to my youngest daughter, but when I think about fearful things, when Erin was growing up, we used to talk about CGI, blue screens, green screens, all sorts of stuff to explain fear and different things for horror movies. And, you know, she loved a horror movie and she loved something, but there was a program which had a guy who was dressed like not dressed, but he had prosthesis on, like an adult mouse, but he was a man and his name was Mr. Tibbs. I can't even remember what he was in. He, honestly, Erin still talks about him. I'm so scared. She was terrified of him. So if you do something like that, that is utterly terrifying for some people. Lola, it could be something they don't want to admit about themselves or say out loud, or something like swearing allegiance to a political party they don't like, something harmless. Yes, again, do no harm. Don't make anyone worse off than they actually were. I mean, there are so many things that you can do, honestly. And as I say, you can be really nice to it. And please give the person a specific safe word in an interrogation scene if it gets too much, so they can call it at any time. You can use all sorts of different things. I would really go for the binaural recordings and tapes, because it feels like there are people walking in the room and all sorts. And you can get your reality very mixed up, especially if you're very sleepy. And it's surround sound, so it goes around you, so it's very confusing. If you really want to be clever and you are in a room somewhere, have the doorbell go. Or if you've got your Alexa set up for your doorbell, make it ring the doorbell. Put a different pair of shoes on, open the door, come in. Have a recording of somebody. It's quite simple with a phone. Hi. Oh, hi. How are you doing? I'm good. How are you? You can arrange that easily. Watch your acoustics, because they're not always necessarily very good. But get your doorbell to go. Get someone else to come in, maybe. What's happening here? So you can make this as dark or as light as you like. You can make it work in all sorts of different ways. You really can. Again, consent, consent, consent. If the person is cold, warm them up slowly, make sure they're okay, get them a hot drink, look after them. Bath them, look after them, especially if you've stuck them in a load of shitty mud beforehand or something else as well. Like, I can't bear the thought of shit being in my hair. I hate it. So, like, if I'm rubbed in mud and it's in my hair, I'm like, it's really annoying. I'd want to get it out. So we all have different things that work for us in different ways. Find it. When people talk online about like mock executions or fake blood or whatever, like all these things are fake, like uniforms and everything else as well. It's about feeling threatened. If you want to make someone threatened and you don't want to use a knife, take a piece of metal that is flat, put it in the freezer. When it's stone cold and you run it across their body, it feels like they're being cut often. So a piece of metal that won't cut, that's been in the freezer, is really handy as a fake cut. If people are frightened of things like violet wands can actually burn and mark. If somebody's into that and they like the smell of burning flesh, get yourself a very sharp glass tool and the violet wand and start writing something on somebody, saying, you have no idea what I'm writing, do you? And it's really going to have an impact on you for the next few days. I suggest you wear your clothes very well. Little things, that really start to get to people, but they can smell the burning flesh. Now, it's not as bad as that. A violet wand can leave a very light burn that brushes off in the next day. I don't mean a burn, for fuck's sake. But we can also do things that hurt. We can use things like sit with ginger in your fucking cunt or arse, chili peppers, all sorts of stuff. But again, anything that you do that can be out of control will ruin the whole scene and make a real difference. And it's not particularly pleasant. Oh, it's like finding their currency. Yes, yes, but in the other way. And in both ways, actually. Currency to say, hey, this is what you're going to do. This is what's going to work for you. I believe in doing this with children, not this, clearly. Right? So when you deal with a child who's misbehaving, you have to find the thing that gets to them. All four of my daughters were totally different about this. If I said to Brian, I'm disappointed in you, she would collapse. I knew that, so I used it very rarely and very carefully. If I said it to Darcy, she'd tell me to go fuck myself. She wouldn't give her monkeys. But if I did something to do with taking her clothes away or her looks away or something she was going to get dressed in, oh, there's the currency. Fuck me. She'd been, I've got power. Kaylin, it was hair and makeup. Erin, it was more around money and different things. Find the thing that works for your person. It works for children as well. Find the thing that costs. I'll take your phone away. It's not a problem. No, you won't. Yeah, I will. I'll turn the internet off or whatever. So, like, it's always find the thing in an, like Mark says, in an evil way. Also find it in a good way. Rewards at the end. You've been such a good girl, such a good boy. Thank you. I mean, there are a couple of points where maybe you're disappointed, but you can work on that for next time. But, you can always throw something in at the end. Anyone got anything else they would like to ask about interrogation disease? Do people feel that they've learned something about interrogation there that's maybe a bit different? And of course, temperatures can really work. So when you've got a very cold body, something can feel really hot and it isn't necessarily. That said, if you want to hurt someone without burning them, please be careful. Talk about how their skin reacts and everything else as well. Please be careful. But of course, a hot spoon or something on someone's body, not boiling, it can really make a difference. My mum would ground me from going out with to turn the internet off for my brother. Yes, exactly. We're all different, aren't we? God, there's so many humiliating things around phones. I'm in your phone. I've got your mother's text number here. I'm just taking a photograph. You wouldn't? No, but I might send it to your teacher. Fuck off. But a little bit of doubt, a little bit of, no, but actually, Jerry and I are good friends. I think I'll just pop one of those pictures to Jerry. Of course, fucking hell, We know we're not going to do it because it's not consensual. Think about those things. Okay, so we've covered sounding today. Sorry, I appreciate I've gone on for 2 hours. I hope we've covered everything to do with sounding, good and bad. I hope. If you haven't, please ask. We've looked at emotional and masochism and sadism. And I hope I've really covered how serious that is and how dangerous it is, and please be careful. And I hope we've had a little bit of fun with interrogation. If you would like any questions for next week, or if you've got any ideas that you want me to cover, let me know. Zoe, thank you, Deb. It's been a really good one for learning. Cool, I'm glad. It's amazing what you've got in your head when you think back in history. It's been lovely to listen again. Thank you, Saraswati. Dominant Ivory, absolutely fab. Thank you. Thank you very much. If anyone's coming on Sunday, please come and say hello. As I say, you don't have to wear a mask in the workshop. You don't have to wear a mask when you're eating. However, the problem is the bar is closed for food. But we can order food and get it in. If anyone would like to join you, yes, please, everyone come. Memorial, wonderful. Thank you. Steele, thank you very much for the workshop. You're really welcome. All I ask is that you advertise them with me, or you come along and we get loads of people coming in and we share the learning. I've been doing this for 39 years. Like, I should have quite a lot of ideas. I should do. Luke says, thank you, as always, looking forward to Sunday. Yeah, come and join us for lunch, everybody. Been really interesting. Thank you. I definitely had looked at. Good. Thanks for today. Deb says, Cinders, it's been a great. Thank you as well. Hannah, thanks, enjoyed it. Recovering from false accusations. Okay, so that's the subject for next week. Oh man, that's a big one, isn't it? Pen and paper. So, recovering from false accusations. Oh, that's a big one, isn't it? Anyone got any other subjects they would like covered, or shall I put them out to the internet and see what people say? Thank you and have a great night. Thank you, Annie Mark. The workshop was great. Thanks for that. It's great that you are so keen and proactive. Thank you very much. Opal Fruit says, awesome. Lamb. Yay, Dom, I can't wait to meet you. So we've got recovering from false accusations. Thanks, great. Burning out. Okay, so like burning out of stress or burning out the scene? What do you think? So like, I mean, I think burnout happens from the scene as well. Everybody gets extremely, people will say to me, and those people here, Deb, don't burn out, stay around. Deb, please don't burn out.
Boredom and complacency.
So should we talk about burning out from boredom, stress, and on the scene? Should we just cover it all? Hypno is an extremely interesting subject. Oh, Martha. Yes, it can be, and it can work on some people and it can't work on some people. And statistically, those people that are therapists in the scene alone, if you look around, the ones who are most likely to cause you damage are the hypnotherapists rather than the counsellors. Why do I say that? Because I can name you 10 right now who have been abusive, and I can't name that many from any other genre. So I have a little bit of an awkward relationship with hypno. So I would suggest, look, that's something I wouldn't talk about because I have a bias against it slightly. I'm sorry, I do. So I would say go to the hypno places. There are lots of classes on hypno and it can be really great for some people some of the time. I have a little bit of a problem with the amount of abuse that comes around it. So again, you see, like, I think I'm very realistic about what I talk about. So I struggle with hypno. Luke says, my new friend, loved meeting you. And your talk last time, so I was coming again. How cool is that? Thank you very much. I like meeting them too. Both would be great. So we'll do all of that. So we've got recovering from false accusations and burning out. Anyone got another one before we end, or shall I just ask? And Andy said, great session as ever. And Shankar said, thank you. Thanks very much, guys. I really appreciate it. I don't ask for any money. I do have a patron and I do have coffee, and both under the King Shrink. So feel free if you want to chuck me something, and fucking don't if you don't want to. Mark says, acknowledging bias is important. Thank you. That means a lot to me. I'm a hypnotherapist and I agree with some of what you said. Thank you. I really appreciate that. Hypno was in the most vulnerable place and all my boundaries were crossed. Never again. I do have, yeah. Yep, that was a message. Shower time at House Ivory. Thanks as always, Deb. See you this weekend. Will do. So thank you all very much for coming. I really appreciate you all. We've got another topic. I'll ask people on FetLife and we'll see where we go. See you next week, and or see you on Sunday if you're coming to Lamb. Thanks, guys. I really appreciate all of you coming. Thank you. Opal Fruit. I can't. Okay, that's no problem. Thanks, Debs, beautifully handled, and please don't have too much fun without me Sunday. I will miss you. Cosmic, you also catch the archive on YouTube. Reverend Chili says thanks. Bye, 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 people. Really take care. See you later. Bye. Wank away. Bye.